This is the heart. This is the right atrium, right ventricle, left atrium, left ventricle, and this is the aorta. So what we need to do is, for example, let's forget about the chest leads at the moment because we were talking about the frontal leads. The frontal leads, lead 1, 2, 3, AVF, AVL, and AVR. I said they look at the heart from a frontal point of view, and we talk about whether it's on the upper side, lower side, or right or left. So now let's take the lower side of the heart. The lower or the inferior side of inferior wall of the heart is represented by three leads. They are lead 2, lead 3, and AVF. Do you remember the angles? Lead 2 plus 60, lead 3 plus 120, lead AVF plus 90. So they look at the heart from an inferior side. That's why if you have any changes in these three leads, you will say we have some sort of defect in the inferior wall of the heart. That's how you make sense out of ECG. Now let's move on to the left lateral side. On left lateral side, at the moment we have, for frontal leads, we have AVL and lead 1. They look at the heart from the left side. That's why if you have any changes in these two leads, the left side of the heart is there's some sort of pathology there. And IVR is looking at the heart from the right side. So I hope we made that clear. And now let's come to the chest leads. In case of chest leads, if the other leads are called frontal leads, this one is called transverse or horizontal leads because they look at the heart from a horizontal point of view. It does not talk about left and right, up or down. They talk about it like horizontally. It's like it's like you have a piece of meat and you're slicing a knife through it. This is the same for the chest leads. And remember, for the chest leads, we mainly talk about their position, where they located. For example, as you can see, V1 is more located on the right side of the heart. That's why it's more specific to the right side of the heart. Whereas V2, V3, and V4, they are more located in the anterior septum of the heart. The anterior and the septum of the heart. Here is the septum of the heart. So, whereas V5 and V6, they are more located on the left side of the heart. So, now let's combine all the leads together this time. For example, if I tell me the leads of the left side of the heart, which leads you will tell me? Of course, you'll move to this side. You will say AVL lead 1 and V5 and V6 as well. They look at the heart from a left lateral side. Okay, now let me ask you which leads are looking at the heart from inferior side. This will be the leads 2, 3, AVF. And we have AVR looking at the right side of the heart. Sometimes you can combine it with V1, but nevertheless, AVR is it's like we call it like an independent lead. It's really independent from the other leads, so it's better not to combine it with any other lead. And when it comes to the rest, there are some resources that tell that V1 to V4 they look at the heart from anterior septum, but actually we can separate V1 more to the right side of the heart and V2, V3, V4 more to the anterior septum, and we will see why in just a minute. And now what we talked about, let's make one summary again. Lateral leads, lead 1, AVL, V5, V6, inferior leads, lead 2, 3, AVF, anterior septal leads, V1 to V4, but as we said, V1 is more of the right side. And in case of the blood supply, all of the sides of the heart have its own blood supply. Remember, the lateral leads are more supplied by the left circumflex or diagonal branches of left anterior descending artery. In another word, we have the left side of the heart and the anterior side is supplied by the left coronary artery. And left coronary artery further classifies into different arteries. But remember, for left lateral, most of the time is left circumflex artery, and I will talk about this in the next slide, but nevertheless, let's talk about it here as well. In case of inferior leads, we have It can be right coronary artery or left coronary artery. I will explain that in the next slide. And in case of the anterior and septal, we also have some variation, which I will explain it now. But what I wanted to draw your attention to was this picture. This is an ECG picture, but we kind of paint it. And the reason is to tell you that this lead 1, lead 2, lead 3, AVR, AVL, AVF, and lead V1 to V6. So please remember lead 1, AVL, V5, V6, they relate to the left lateral side of the heart, V1 to V4 anterior septal, whereas 2, 3, and AVF to the inferior side of the heart. I hope that's crystal clear. And now in case of the blood supply, uh, remember something, there's the left coronary artery. It divides into left anterior descending artery and the left circumflex artery, and the left anterior descending artery has some other branches like the diagonal branches, but this is not so high yield. You just need to know the main artery. And whereas the right side is right coronary artery, then we have the right marginal artery, and we can have posterior descending artery from the right coronary artery as well, but I will explain it now. Remember something. First of all, in case of the conduction system also needs blood supply. The SA node, AV node, everything that we talk about, and especially we're going to talk about SA and AV node because these are the most important nodes because they can beat at a higher rate comparing to other. For example, SA node can fire electricity between 60 to 100 beats normally. AV node around 40 to 60 beats. But bundle of fees and others, they are lesser that the patient cannot stay alive based on them. But nevertheless, for what we need at the moment is, in case of the blood supply to the SA node, in 60% of the population, of human population, it's supplied by the right coronary artery. In other words, if you have a problem with the right coronary artery, let's say there is atherosclerosis and there is no blood flow, in 60% of the people there will be no blood supply to SA node, and it will cause problems. Whereas only in 40% of the people is supplied by left coronary artery, and especially a branch of left circumflex artery. So it's variable. It's not like something specific to every humankind. It's totally variable. Whereas in case of AV node, 80% is supplied by right coronary artery and only 20% is supplied by left coronary artery. By the way, there is something that I want to avoid, a kind of confusion. When I talk about, for example, in case of this blood supplies, I don't mean that, for example, AV node 80% is supplied by right coronary artery and the rest is supplied by left. No. What I mean in 80% of population, AV node is totally supplied by right coronary artery and vice versa. So please avoid that confusion. And now we have something else also called, is the patient right dominant or left dominant or codominant? You might have heard of this. The main thing is that determines whether the patient right, left, or co is to look at the posterior descending artery. This artery that's here. This artery. In case of posterior descending artery, if it branches off the right coronary artery, then we call it right dominant. If it branches from the left coronary artery, we call it left dominant. If it branches from both of them, we call it codominant. But mainly in 85% of the population, it branches from the right coronary artery. 10 left coronary artery and 5% of the population from both sides.